a lump in your breast or underarm that doesn't go away after your period. This is often the first symptom of breast cancer. Lumps associated with breast cancer are usually painless, although some may cause a prickly sensation. Lumps are usually visible on a mammogram long before you can see or feel them. We speak to Dr. Reddy to find out more.
Dr. Reddy, thank you for joining us on Living Your Best Life.
My pleasure, Maria.
So today we're going to talk about a topic that affects women in general, and it's so important that we start engaging in opening communication about it. We're going to talk about breast cancer. So before we start, maybe let's talk about how does this happen?
Well, breast cancer development is multifactorial. It is the most common cancer affecting females worldwide, and the same as here in South Africa. And there's a few things that must occur for breast or any cancer to develop. One is the cells must have some sort of abnormality in the genes, and usually the cells will have a point where the gene identifies, or they know that there's an abnormality, and it sort of kills itself off. And then if the cell doesn't kill itself off, what we call like a suicide influence, then the second component is the immune system. The immune system will usually detect it. If it is abnormal, the immune system will sort of kill it off. And the third component is that it can mimic. So although it is abnormal, but it provides a facade that the immune system can't detect. So those three components must be available for any cancers to develop. And there are different risks amongst races. Amongst the Caucasian population, they have a higher risk compared to the Indians, coloreds, and amongst the blacks. Then there are other risk factors that come into play. Some of them are hereditary, whether you're born with a genetic abnormality, and those patients that are hereditary predisposed to cancers are going to develop cancers in their lifetime. And then there's the most common, which is a multifactorial influence of lifestyle, diet, exposures to different environments, whether you've got dense breast tissue, whether you're overweight, whether you've got a history of proliferative breast disorders, all of that, whether you've taken hormone replacement therapy, whether you've had your first child at a later age, never had or never bore children, all of those are risk increases for breast cancers to develop.
So what are some of the symptoms that one should be looking out for?
Maria, the one thing about breast cancer, it is usually not painful. So, unfortunately that means that that's part of the reason why there's so many delays. But in breast cancer, most patients would present with either a lump, and that's how they would present to a clinic like ours. Or they present in this era where we are screening more patients. You're going to present with earlier disease, which is only detected on screening abnormality or screening mammography. But other subtle signs may be nipple retraction, pathological nipple discharge, which is a blood-stained, watery nipple discharge, skin changes, lymph glands in the armpit. Those are all ways clinically in which patients may present.
What about women that have breast augmentation or implants in their breasts? How do they try and find out whether they've maybe have breast cancer?
Well, they would follow the same protocols. Most implants are either put subglandular or subpectoral, meaning under the muscle or under the breast. So the breast tissue is actually exposed still. The only problem with augmentation is that it makes it more difficult for the screening investigation. So for example, the mammogram, because you've got to compress the breast, with the implant being in place, there are certain techniques that the radiographer would have to put the patient through in order to ensure that we get an appropriate imaging of the breast so we don't miss anything earlier.
Let's talk about some treatments available to patients that are diagnosed with breast cancer.
Well, look here, the management of breast cancer, like all cancers, is multimodal therapy. Surgery forms one arm of that. But then there's chemotherapy, which is a form of systemic therapy, which we use routinely. There's radiation therapy, which is a local therapy to the breast field. There's targeted therapies. In the biological makeup of cancers, certain cancers overexpress certain markers on their membranes, and we're able to identify those markers, and then we are and there's the newer form of therapies that we use target these markers to allow the therapies to be addressed at that level. And then there's endocrine therapy. So certain cancers feed off the female hormones. By blocking or suppressing the hormones, we're able to regress the influence on of the cancer itself.
Would you say that a more holistic approach to treatment is required when treating someone with cancer?
I think in this day and age, any person diagnosed with cancer, whether it be breast or other, should be discussed in an interdisciplinary manner. It is difficult for me as a surgeon to on my own individually decide on what the best management plan would be, because I may be influenced to want to more biased towards surgery. Whereas if they go to the oncologist and they only see the oncologist, he's more biased towards chemotherapy or radiation therapy. So I think everybody sitting together to discuss the treatment going forward is vitally important. They are all like different types of cancers, and biologically they are different. Breast cancers themselves have their own personality. Certain cancers may be small but very aggressive in nature, which chemotherapy may be more beneficial up front. Other cancers, although they may be very large, they may be slow growing, and surgery may be a better option. Chemotherapy may not be warranted in certain types of cancers where endocrine therapy or hormonal-based therapy might be better for the patient. So there are differences, and unfortunately, if we manage patients as though we are small little islands, everyone apart, nobody will actually put the patient at the center. We are all doing what might be best for us. So managing patients, all patients with any type of cancer, should always be done in an interdisciplinary form.
One of the biggest fears, I think, especially for me, if I had to be diagnosed with breast cancer, is the possibility of losing a breast. When would you say to a patient it's time that we have to remove that breast, or we can actually save the breast?
Maria, what we actually look at staging patients. I think when we look at the stage, we've got early stage and advanced stage of cancer. So, commonly one would hear stage 1 and 2, which will fall into early breast cancer. Stage 3 would be locally advanced breast cancer, and stage 4 would be metastatic cancer. In the patients with stage 1 and 2, which is the early breast cancer, breast conservation therapy, which is trying to preserve the breast volume, shape, or architecture, may be used as part of your surgical treatment, which means we don't have to remove the entire breast. Stage 3, unfortunately, those patients will require mastectomy. And stage 4, the significant component of the disease is the metastatic component, which is not the breast. So we treat the patient more with systemic disease and only manage the breast if we have to. But when we're looking at the surgery, or what we are trying to achieve nowadays, in the form of breast conservation therapy, which is trying to maintain a breast mound or breast shape. It is important for all females to have, or to give them the option, if it is suitable, to save the breast.
Thank you so much for joining us today.
Thank you. Sure.
Busamed Gateway Private Hospital, the first purpose-built surgical and cardiac hospital in KZN. Visit busamed.co.za. Busamed, premium care, personal touch.